Every single year, 3 to 5 million kids and teens experience concussions. But determining if they actually had a concussion can be difficult because many have never received a baseline exam. Now, getting that baseline exam is easy and affordable thanks to ChoiceOne Urgent Care.
Something new that we're doing at ChoiceOne is helping people with the diagnosis and management of patients who sustained a concussion.
Dr. Scott Berger is the Chief Medical Officer for ChoiceOne Urgent Care.
So a concussion is a clinical diagnosis. It's not the sort of thing that you need a CAT scan or an MRI for. Those are for actually detecting more significant and serious brain injuries. So what a baseline test is, something that you would do prior to somebody having a head injury. And what that allows us to do is to assess any underlying symptoms that the person may experience on a daily or regular basis, to assess their what we call neurocognitive function. So how well they're thinking, processing information, and using that to make decisions, and also to assess their balance. So that way, if somebody sustains a head injury, we can measure and compare what their symptoms are like now, how well they're processing information, and how well they're able to do on balance testing after they've had the head injury.
Dr. Berger says this is especially important to consider now as your student athletes are headed back to school.
I think every athlete, not just the football players, right? It should be for the cheerleaders, it should be for basketball, it should be for lacrosse, it should be for soccer. All of these athletes should be having baseline testing done. It's no longer just getting your bell rung, right? We all understand, and there's so much more information.
So what age and how often? Well, 9-year-olds to preteens should come in every year for one, since they're still growing rapidly. Teens every other year.
You know, so often in the past, parents would think of that if their son or daughter sustained a head injury, that they automatically had to go to the emergency room to be diagnosed with a concussion. When in reality, only a very small percentage of people who sustain a head injury actually need to go to the emergency room. After they leave the emergency room, that's where we see in the American healthcare system a huge gap. There was a recently published study that showed over 50% of patients who sustained a concussion who were seen in the emergency room had no follow-up within 90 days.
And here you guys make sure that you're following up and there's the management beyond just the initial visit.
That's right. So we track these people through their recovery process. We use the guidelines that have been established by the Centers for Disease Control on the Return to Learn program, so getting athletes and anybody who's sustained a concussion back to academics, as well as the return to activities.
Both of which will be gradual, with cognitive and physical measurements tracked along the way, so parents, teachers, and coaches are all on the same page.
The beauty about ChoiceOne Urgent Care is that patients can come in 7 days a week from 8 a.m. till 8 p.m. for any of our services, whether it's related to a sports-related injury that is a concussion, or if they're sick, you know, sore throats, sinus congestion, sprained ankles. We'll see them from 8 a.m. till 8 p.m. every day of the week.
The baseline concussion exams are an affordable $75, but mention that you saw this segment on Midday Maryland, and you'll get it for just $25. We'll be back with more Midday Maryland right after this. Stay tuned.